morning. This is Bonnie Michelson, and I am Director of EMDR and Beyond here in West Des Moines. And I have the pleasure of talking to my wonderful colleague, Elyse Harper, who is also in West Des Moines. She is an approved consultant, a specialty EMDR trainer, and she also trains for the National Resource Center for Family Centered Practice out of University of Iowa, among other things. Oh, and as a coach for EMDR basic training. A few years back, Elyse wrote a post for us called Assisting Clients in Joining the Emotional Bandwagon. And we are going to talk with Elyse today about why she wrote that post and help us get kind of a preview of what she's teaching in that information on our website. So welcome, Elyse. Tell us a little bit about what made you come up with that post.
You. Well, I'll say before going through EMDR training, I had a very rudimentary understanding of the connection between a client's emotions and their bodily experience. And I think even when I first got trained in EMDR, they use the train metaphor of, you're going through the memory and you're seeing the images. And so in my mind, it was very image focused. EMDR was very image focused. And with the help of my consultant, I very quickly realized I also needed to ask people about their bodies. And then once I started asking people about their bodies, I noticed how much deeper the work went and how more quickly the work went. And so once I figured out that I needed to do that, I also discovered that some clients weren't a big fan of that. So I had to figure out how to get them on board with this new exciting area of EMDR.
Yes, and I'm sure you've run into that as a consultant too, that there's lots of challenges for people in accessing emotions. Have you noticed any particular presenting problems that are more likely to have blocked out their emotions?
Boy, I wouldn't say that I would point out any specific presenting conditions. I mean, certainly if somebody's more dissociative, they're going to have a harder time connecting with their body and their emotions. But that can manifest in any presenting problem, right? So somebody who is anxious and then they reach their threshold of anxiety and then they kind of check out, or somebody who's depressed and they've kind of numbed out to the degree that they've checked out. Eating disorders can manifest in the sense that they restrict to check out or they binge to check out. And so a lot of these presenting issues can either result in people actively disconnecting from their body, or sometimes it's just a end result of them, of their symptoms resulting in them checking out from their body. And so I would say it's kind of all presenting problems in one form or another.
Yes, makes a lot of sense. And more, what has the client used to cope with the overwhelming emotions that come from their trauma?
Exactly.
That's more the point. Okay, tell us a bit about some strategies that you use to assist clients. For example, in the preparation stage, do you have a spiel that you tell them?
I would say that first and foremost, and I know this is maybe over talked about or overdone, but I feel like you can't emphasize it enough, and that's having a really safe therapeutic relationship with people.
Absolutely.
More so than any fancy EMDR strategies or tricks. Because I think, again, sometimes you come out of EMDR training, you're like, okay, so I have a couple of these strategies, whether it be safe place or container, and then people are just going to be able to manage their emotions. And it doesn't really matter how they feel about you or your office. It's just going to work because now they have this magical trick and they can manage their emotions. And so I guess first and foremost, I make sure I have a really good relationship with them. And then, you do some just general exploring about, what emotions do they struggle with being in touch with. So some clients, for instance, might feel really comfortable with anger, but have a really difficult time with sadness. Some clients have a lot of difficulty, and I know people inside the therapy world understand this, but people outside the therapy world might not understand that some people have a lot of difficulty with calm. Some people have a lot of difficulty with happiness or feeling content because their baseline has been just all over the place, or their baseline has been, anxiety. And so to feel calm can feel really uncomfortable. I had a client, just in the past week where we had done some really good deep work, and she came back the next week and she said, Elyse, it's like you changed the channel in my brain. Like, I don't know how to not be anxious. I don't know how to feel like this. And so anyway, so the first step is just finding out what emotions they are or are not comfortable with. And then it's kind of providing psychoeducation about what I say is like, they're called feelings because we feel them somewhere. And a lot of times people will say, well, I'm anxious. And I'll say, well, how can you tell? And they'll say, well, it's in my head. It's in my head. And I say, well, does your head feel a certain way? And they'll like, no, I just know that I'm anxious. And I say, well, they're called feelings because we feel them somewhere in our bodies. And so the more difficulty they have with that, the more time we kind of have to spend on that step in terms of kind of connecting their feelings with physical sensations, which sometimes that can be really activating for people even without bilateral. So that's additional information that we're collecting. So I would say those are just the basic bases that I cover with people, is finding out which emotions they're comfortable and uncomfortable with, and how able and or willing are they to connect those emotions with the physical sensations.
Mm-hmm. So that
Obviously, then the next step would be maybe doing something like resourcing where they can have some positive experiences in their body, whether it be, a relaxing resource, or again, for some people, maybe it's more of an upregulating resource where they kind of get their body moving faster if maybe they move too slow, like in the case of somebody who's been dealing with depression for a long time.
you bet. Yeah. So you start out by looking at which emotions they might have challenges with. And I like how you talked about even challenges with positive emotions, because that can be unexpected if you haven't run into it before, but it makes so much sense in terms of trauma. If the only time things were calm, you were waiting for the next awful thing to happen, you learn that calm is not safe. In fact,
Right.
we joke about doing EMDR with EMDR, and one of the things is it's not safe to feel safe, or it's not safe to feel. Yep. So hence the importance of your topic. You mentioned in your blog, Sandra Paulson's handout on emotions, and I'm sure she's not the only one who has one, but how do you use that particular handout?
So what I really like is she groups emotions into life preserving and then life enhancing. And she kind of discusses how if you don't address the life preserving emotions, it's hard to have access to the life enhancing emotions, which of course makes sense. Because if you're being chased by a tiger, your body does not really have time to stop and smell the roses. And so if your body is still in being chased by a tiger mode, it is going to be harder for that person to access, love and joy and laughter and all those things, which is of course the end goal. But it also kind of reframes what some of our clients might think of as negative emotions or bad emotions as working in our benefit. So perhaps we don't want to feel anxious all day, every day, but how has that perhaps served us in the past? So of course, this is kind of the stereotypical example, but somebody who was in the military, being hypervigilant was their training. So that was encouraged. That was and that's what kept them alive, right? And I had a client, and she was in the military, and when we were discussing this, she was like, well, you got to be looking around your surroundings, you got to be aware of things. And I said, well, yes, I'm not saying you need to just become a bobblehead and not aware of your surroundings, but you also don't need to feel as if you're in the middle of a war zone when you're shopping with your daughter in the mall, so it's kind of helping people find a new normal around any given emotion. So I can't remember exactly what your question was.
That's all right. You've been answering it. So no problem. So it made me think of a couple of things. Both of us are trained as family systems workers, even though we work with all kinds of clients. And I know that I learned early on that families that were troubled, often the only emotion they expressed was anger. If they were afraid, they got angry. And I'm talking about the caregivers. And then the children would respond either similarly or the opposite, become upset with anger. So you do a lot, you really do have to weave in education about emotions and get past a common challenge we all have in all kinds of therapy, to not label emotions as negative. So I can see the value of why you used Sandra Paulson's information, because it's hard to talk about both of those types of emotions as being the equipment we came with as humans.
Right.
Um,
Well, and I think it can translate into behaviors as well. I think sometimes, so emotions, right? So even the quote unquote bad emotions, like let's say fear might then result in lying. And then our clients are like, well, I was such a liar when I was little, and I'm still such a liar. And it's like, okay, I understand that you don't like the fact that you are dishonest, or maybe that's your first impulse to be dishonest. But, I wonder what was the intention of that emotion or that action of lying. It was to protect yourself, it was to keep yourself safe. So, although maybe that's not an adaptive coping skill anymore, can we maybe be a little less hard on ourselves
yes.
for how we were acting in that situation? And then sometimes that can kind of help release some of that guilt and shame, and then get things moving, and people can get kind of unstuck in some of those life preserving emotions when they realize, like, oh, first of all, that was a pretty smart strategy, and second of all, maybe I don't need that strategy anymore. So
Mm-hmm. Sounds excellent. You talked about 3 or 4 different examples of presenting reasons why someone might not embrace their emotions, so to speak. And you don't
yep.
have to talk about all of them. They can read the blog post, but I would
Right.
like you to talk about a couple. And the first one would be under accessing, because I think it's so common. I loved and felt so validated when Bessel van der Kolk wrote that. All of us are it's harder to work with people who under access than people who are over accessing, because they
Mm-hmm.
have very good reasons to have blocked those emotions. So
Right.
just give me an example of what a client might say if they're a under accessor, and how you would respond. Some ideas.
Yeah, so sometimes they'll just say, I mean, they might literally just say, I don't feel anything. you know,
Sure.
you turn on your buzzies, and you've done your access and activate, you've done your phase 3, and you think you're off to the races, and you're a set or two in, and they just kind of look at you a little blankly, and they're just like, well, I don't notice anything, or I don't feel anything. Um, and a lot of times I think curiosity is your best friend in that situation. I'll just get curious about that. I'll just say, I wonder, did you feel even like a hint of something before you started feeling nothing? Because a lot of times maybe that the emotion that their body and system is phobic of did kind of start to come up, and then it was like, oh, numbed out. And
Sure.
I'd say 9 out of 10 times people will say yes. Like they'll be able to say, um, you know, a little bit of anger was starting to come up, and then I shut it off. Oh, and a lot of times people will even be aware that their body did it without their permission. They'll even be aware that, oh yeah, I was here, I was raring to go, and my body and brain were like, nope, not happening.
Right.
And so then sometimes it's like you said, doing EMDR on EMDR, or you can do EMDR on your fears about what might come up when doing EMDR. So if they're saying, I was feeling a little anger, and then you just kind of do a little exploration around what's scary about it being angry. And sometimes it's, well, if I start being angry, am I just going to be a maniac with my kids and husband, and I won't be able to stop being angry? And then I do some psychoeducation about, well, have you ever felt really happy? Yes. And I say, well, did that last forever? And they say no. And so it's kind of providing just that psychoeducation, is that no feeling lasts forever. And often, if you give the feeling the attention it needs, then it moves on. I always use the example of, if you get a text message, and you don't check it, your phone will keep beeping at you until you check it. And our emotions are the same way.
Yeah.
And yeah, maybe you can turn off your phone, but eventually you're going to have to turn your phone back on. And then that message is going to be there waiting for you. So our emotions are the same way. And so it's just kind of providing that psychoeducation for people, and then people can kind of understand the point of it, because so often it's like, Elyse, you're telling me I think I had one client, he said, "So you're telling me I need to push my wound? Like I need to put my finger on the wound?" And I'm like, "Yeah, I'm not saying we have to push really hard, but we do need to touch the wound.
Yes,
Um, and then, we can open it and clean it out. And people understand that too, is if you have a physical wound, you need to address it or it's going to get infected. And, if you wait long enough, your arm falls off and nobody wants that. So the
right.
same can be true with our emotions. And that kind of goes into, I've been talking to people a lot lately about, the saying of time heals all wounds, and time can heal some wounds, but some it doesn't. And
Right.
so that's where EMDR can come in. I mean, again, that's like saying time's going to heal a stab wound. It's like, well, yeah, but not without some assistance, not without some watchful care and concern. So even though our emotional wounds are invisible, it doesn't mean they aren't there and don't need to be tended to. So
Absolutely. Absolutely. You actually gave an example of blocking beliefs, which you didn't name it that. And I know Jim Knight developed blocking beliefs, that phrase, and has a great deal about that and avoidance defenses and other things in his book, EMDR Toolbox. But we
yeah,
know that there are beliefs that block where the client needs to go. And you talked about the one of the main ones, just if I start feeling, I won't stop. Your example was anger. I run into it with tears, and you don't
yeah,
ever say disrespectfully, well, that's crazy, but you say, well, do you know someone who started to cry and they never stopped? Well, no. So
right.
but you need to respect that blocking belief, because where they got it is from their survival tool suit. Anything
Yeah.
more you'd like to say about blocking beliefs before we move away from that example?
Yeah, I think, like you said, I think it's you could think of that in a lot of different ways, and I guess for me, I've kind of conceptualized it is kind of the emotions about the emotions, and so like you're saying, it's the fear of the tears or the fear of the anger or just the fear of the overwhelm. And the fact of the matter is, when they were traumatized, what made it traumatizing was that they were overwhelmed. So of course they are afraid that if they open it up again, they're going to feel that same level of overwhelm and won't be able to handle it. Maybe not realizing that they now have different support or they have different skills or tools than they did at the time of the trauma. And so those are some other things that you can kind of help work with them and help them realize is that, okay, yeah, this was completely overwhelming and unmanageable when you were 5, but now you're 35 and you have a loving husband and you have a therapist that can help you through it, and you
Yeah.
aren't without support, and just kind of helping ease some of those anxieties. And of course, you're not going to cognitively talk them out of all of this, but
No.
it can help provide some background information and provide some hope for them that, okay, yeah, I hear what you're saying. I may not believe it, um, but okay, I'm willing to give this a whirl. And then, you can do some strategies to help titrate those emotions and make it less overwhelming for them.
Would you talk a little bit more about interweaves when you're working with a client and they're in the midst of really intense emotions? Um, how do you handle
Yeah.
that?
I know one of the main ones I talked about in the blog is if you're feeling, you're healing. And that can kind of help reframe for
Yes.
people who have been so phobic of their emotions. It's like, oh, okay, this isn't dangerous. This is actually what I'm supposed to be doing. Like, I'm actually benefiting myself by feeling these hard things right now. I'm not hurting myself by feeling these hard things. And that is counterintuitive. I mean, like when you go to the dentist and they're poking your tooth and it hurts, you're not like, hey doc, please keep poking my tooth, although they do have to drill on it to get the cavity out. So that is um, an analogy I use. I'm not going to go to the dentist and just have them keep poking my cavity all over and over, but I will go and let them drill on it and address the issue, and so then my tooth doesn't hurt anymore. So anyway, if you're feeling you're healing, that can kind of help reframe having hard feelings for people. I also just encourage them by just saying, you know, good job, you're doing well. I remain very calm. You know, I don't start getting panicky like, oh, you're feeling big emotions. This is so big. You know, it's just you just act as if it's very normal. It's very calm. You know, you just the classic one too is like, this is old stuff. This is
Yes.
stuff you don't need anymore. Um, this is in the past. So those are all different things. And of course, it can be client specific or memory specific, but I would say those are some good general ones when they're in the midst of having some big feelings.
Excellent. And you make excellent use of metaphors. It's sprinkled in your conversation, it's in your blog, and I know it's in the trainings that you've done, and that's wonderful. I do have to say that I had one of my favorite clients who had every kind of abuse you could imagine. And she was doing well in EMDR recovery, but she came back in and sat down and looked me right in the eye and said, Bonnie, this getting in touch with your feelings, it's not all it's cracked up to be.
Yeah.
And she had been a master at numbing. I mean, I
Yes.
almost envied her ability to do so, because we had to actually titrate for a while before she'd work for a little while, and then she just numb out, and to normalize that because it's how she survived horror in her life. We just worked with it. Any final thoughts that you would like to share with us?
You know, I don't think so. I think I covered it all in terms of just kind of helping explain to people why they might struggle with emotions and kind of help them understand why you're trying to why you're trying to help them learn a new way to deal with their emotions as opposed to their old ways. And then you have much more success in EMDR. And then once you get the train rolling, usually people are willing to keep going, even if
Yes.
every time they come in, I have a client, she's done such good EMDR work, but she still comes in and kind of gives me a side eye. Like, you're going to make me feel again today, aren't you?
Uh,
Yeah, she
as
keeps
if we
coming
could.
back, and you know, yeah, she knows it's for her benefit, even if it is hard sometimes. So
Yes, I had to change my language with the client I was mentioning because I would say, well, do you want to process now? And she said, no, I don't want to process, but I will process because I know it'll heal me. So thank you so much for your time. We hope this helps people be encouraged to read the post, because I wish I would have had some of this information available in the 90s when I first started doing EMDR. There's a lot of finesse that goes with helping our clients do the work that we know will heal them. And I thank you for your time.
thank you.